At 10 p.m.
An ambitious plan to protect people in the nation's capital. It's a new program that would test tens of thousands of people in Washington for the virus that causes AIDS. Gary Nuremberg tells us about this huge test in a city with the nation's highest rate of new AIDS cases.
Hi, how are you guys doing?
Ron Morgan spent much of Saturday urging strangers in Washington, D.C. to get tested for HIV.
The city is facing a crisis right now with new cases of HIV people, and some people may not even know that they are.
He was diagnosed as HIV positive 22 years ago.
I'm living proof that you can live with this thing, but we have to think straight and be smart.
Come together, D.C. Get screened for HIV.
The city launched a campaign this week to test for HIV all residents between the ages of 14 and 84, believed to be the first in the country to do so.
It doesn't hurt, does it?
No, it doesn't hurt.
Okay.
It pains, no blood or anything. Okay, you ready?
The city is distributing to doctors, clinics, and schools 80,000 of the kits and oral swab that gives results in 20 minutes. The health department wants HIV screening to be as common a part of physical exams as blood pressure and cholesterol checks.
What we're doing is saying that everyone should get tested and sort of normalize it.
Why are city officials so adamant about this new testing program? They cite statistics saying that 1 in 50 D.C. residents has AIDS, 2%, but the city has the highest rate of new AIDS cases in the country.
25,000 people may be in the district that have HIV, and perhaps a quarter of those don't know they have it.
And knowing it is key.
Research shows that those who know their HIV status are connected to care, and that they live longer and they modify their behavior to reduce the risk of HIV transmission to others.
So the city is sending vans into neighborhoods.
So we actually do 3 people at one time doing the 20-minute process that it will take us.
Activists say a rush of new positives will put a strain on city services, but the health department says it is already lining up programs and money.
We'll be there once those dollars are there to actually get these people into care.
Getting people into care is what Ron Morgan is trying to do.
And I'm here in living proof to say that there's life after diagnosis, 22 years later.
Gary Nuremberg, CNN, Washington.
Now, Dr. Greg Payne, the director of the Washington Health Department, is live with us now in Washington. Dr. Payne, why does D.C. have the highest AIDS case rate in the country?
Well, a number of reasons. I think we have our share of urban health problems like everyone else. We have TB, sexually transmitted disease. We have a large gay population, a large African-American population, and this disease disproportionately affects them. So given our statistics and given that routine testing is available now, the CDC is recommending it, we have a quick test, we decided to launch this, what I think is a bold and aggressive campaign to stem the tide of HIV/AIDS in Washington, D.C.
Well, when you send these 80,000 test kits out, how many new cases of HIV do you think you'll diagnose?
Well, our goal is ambitious. We hope to screen as many people as we can. We're targeting everyone in D.C. Age 14 to 84 for screening. And why is screening important? Nationally, about 1 million people have HIV/AIDS, and up to 25% do not even know they're infected. So quick screening is important. You get a result in 20 minutes with our doctors and hospitals to do these tests. And if you find out you're positive, we're going to link you to primary care and the counseling you need so that you can get the treatment you need and then not spread the disease to others. This is the way to stem the epidemic.
So you say you want everyone in D.C. to get tested, but does that include part-time residents like members of Congress, Supreme Court judges, even President Bush?
We're doing and going beyond what the Centers for Disease Control is really recommending, that this testing be routine, similar to getting a pap smear, a prostate test, or a mammogram. HIV testing should be routine, and that's what we're doing. We're making it routine. We're getting these kits out to our docs and hospitals and clinics and partnering with them to screen everyone. So, yes, that could include members of Congress. I know I've been tested. I think everyone in our mayoral task force, which is chaired by Mayor Williams, raised their hand that they had been screened.
Well, our reporter there in the last report touched on something. If a diagnosis is positive, what happens then? If someone is sitting in a doctor's office, gets this life-changing news in just 20 minutes, is the city really prepared to counsel and treat what might be thousands of new patients?
Well, that's part of the campaign, and this test is easy to do. In 20 minutes, you get a result. It's an oral swab. It's very accurate, about 99% accurate. And it's important to link this to pre- and post-counseling to the testing. And we're doing that as part of the campaign. And equally important to the counseling is linking people to primary care afterwards. And that's what we're prepared to do as well, using all the resources in the Department of Health. So we're prepared, I think, to go forward boldly with this initiative because this is public health issue number one for us.
Okay, Dr. Greg Payne, the Director of the Washington, D.C. Health Department, thank you very much for joining us.